Next thing to do is we're going to assess for the range of motion of our client. So, first is starting with the patient having her forearm fully extended on her elbow with the arm. Okay. Attached to the side of the trunk, and ask the patient to flex the arm of the shoulder by moving the upper part until it is above the head. So, I will ask the patient, Ma'am Claire, can you flex your arm of your shoulder until it is above your head? Just like, I will ask the patient to abduct her both arms by until it is above her head, 180 degrees Celsius. So first one, like this, only both arms, okay, wait, see. I will ask you again to abduct your both arms, just like this, okay. On the other side, do you feel any pain or difficulty? Okay. So next is we're going to do the cross-body adduction. In this position, you will ask the patient to flex the upper part up to 90 degrees Celsius, and ask the patient to maximally adduct the shoulder by moving it arm horizontally on the other side, and make sure to do it one side at a time, just like this. Okay. On the other side, like this. Okay, good. Next, after that, Ma'am Claire, can you flex your elbow with the 90 degree with your arm attached to your thumb, with your palm supinated, and rotate the shoulder by bringing your arms laterally. Okay. Fully extended at the elbow and the palms supinated. Okay. Just like this. Rotate it. Okay. Do you have any difficulties? So after that, I am going to proceed in the flexing the elbows of approximately 45 degrees with her fist clenched and the thumbs is up. Now can you position both of your hands behind your back until you touch your lateral shoulder, just like this here. And do you feel any pain? Okay, so that's it. So again, the forward flexion, just like that, and abduction, like this. Cross body adduction on the other side, and the external rotation. And next is the extension, like this. Okay. With the forearm fully extended at the elbow and the palms is supinated. Okay. And lastly is the internal rotation with the fist clenched and the palms is up and okay. Positioning the hands behind the back and touches the apex of the shoulder. Okay, thank you, ma'am. That's it in doing the range of motion of the shoulder. Next thing to be assessed is the wrist, hands, and the fingers. We need to inspect for the contour and compare the symmetry, nodules, redness, or any swelling. We're going to also use the thumb and index finger to palpate both wrist and each finger joint. Make sure to note for any tenderness or nodule present. Next is assess for the range of motion exercise. So first, in inspecting the contour, the color of the nails, inspecting the symmetry, alignment, and deformities of the joint. There are no signs of inflammation or arthritis such as swelling or warmth, tenderness, and redness. There are no also signs of asymmetry, and there are no also signs of cyanosis in the color. So it is a normal color. There are no signs of any abnormal pigmentation. Okay. Okay. Next is we're going to assess for the range of motion. Range of motion of the hands, wrists, and elbows, and the strength. The wrist is in flexion and extension, like this. Radial and ulnar deviation. The hands and the fingers will move in flexion and extension, abduction and adduction, and the thumbs move in opposition. Okay. So in doing the flexion and extension, I will ask the patient to make a tight fist in hand and to extend the fingers open. Just open like this. Okay. Like this. And open. Okay, great. Next is the abduction and adduction of the fingers. Claire, can you spread your fingers apart like this? Abduction, and then bringing back them together as adduction. Okay, stretch it. And adduction. Okay, good. Next, in doing the round for the wrist, flexion in 90 degrees and extension. Okay. Radial deviation 20 degrees and the ulnar deviation for 30 degrees. Okay. So the other hand like this. Okay. Next, moving forward. And the other hand like this. Okay. Okay. Next is we're going to test the carpal tunnel syndrome, which is the penal sign. So we're going to use the penal sign for testing the carpal tunnel syndrome. Carpal tunnel syndrome, it is due to a tunneling or compression of the median nerve that runs in this area of the wrist. So the first test that we can perform is the penal sign. And what that entails is by actually tapping over the median nerve here. If we tap over the median nerve, we elicit symptoms of tingling or numbness sensation over the palmar area of the second, second, third, and half of the fourth digit finger. Here, that's the median nerve. Distribution is, so if we elicit symptoms of the pineal sign of us tapping the median nerve, that's a positive result of a pineal sign. In doing this, slightly percuss the transverse carpal ligament over the median nerve when the patient's palm and wrist meet here. Do you feel any numbness or tingling, like shooting in the palm and the finger? No. So if the patient feels it, it is a positive test of the pineal sign. Okay. Next is the second test that is called the Palens sign, which we also call as the inverted prayer sign. We are doing this by doing inverted prayer by holding our wrists together like this for about 60 seconds. So our patient will get to hold his hand like this, sumante. Put pressure on, like compressing the median nerve. Okay. The patient put back of his hands together and flex the wrist downward at a 90-degree angle. Okay, one breath. Do you feel any pain or tingling? For a positive sign for a balance test or the balance maneuver test, the patient will feel pain and numbness. Okay, thank you, ma'am. The next thing to do, we're going to assess the hips and the knees. In inspecting the, ma'am, can you sit now? So inspecting the knees, we're going to look for the contour and the symmetry. In inspecting the hips for the symmetry, with the patient standing, ma'am, and then inspect anteriorly and posteriorly. Okay. So, as we can see, there are no signs of asymmetry in the iliac crest, the size of buttocks. So, it is just normal. Next is we're going to inspect the position of the knees. So, as we can see, there are no signs of asymmetry in the iliac crest here, the size of buttocks. So, this is normal. So, next is we're going to inspect the position of the knees. Okay. If the patient is bow-legged or donkey, so I guess the patient is normal. Okay. Next is we're going to palpate each hip over the iliac crest and the trochanter area for any tenderness or instability. Okay. Palpate the iliac crest here. Okay. palpating the iliac crest. Put your hands on the hips. Okay. And palpate forward the hip bone. Okay. Okay. Next, in doing the posterior superior iliac the hip bone, palpate backward. Okay. Next, in palpating the trochanter or the greater trochanter, using the both of your palm, rub along the lateral aspect of your thigh, back and forth between the thigh and pelvis here. Do you feel any pain? To find a bony notch. Ito yung buto. Okay. Buto na, diba? Oo. As I can feel, there are no signs of any tenderness or instability of the joint or in the hips. Okay. Next is assess palpate both knees. Okay. It should feel smooth. Okay. But it should feel solid. Assess also for the temperature, comparing both sides. Start at the mid side and work to the mid shin. Okay. Palpate the patient in a sitting position. Start with the joint. Slightly flex knee. Okay. And run fingers up to tibia. Flex and extend. Okay. Next is assess for the range of motion. Flexion. Big flexion and then flexion. Okay. So, patient is should be in a lying position or in a spine position. The patient is in a lying position or supine position with the hips and the knees in neutral rotation. Okay. And the normal range of motion of the hip extension is 10 to 30 degrees. Okay, can you raise it up? The patient. Okay. Need to sit here. Okay. And proceed to the bulge sign. Okay, Ma'am Kara, I will just raise this up. Okay. The bulge sign indicates for the fluid in the joint. It is done for a small amount of fluid present. Have the patient in a supine position with fully extended legs. Then begin by brushing up approximately at the medial side of the knee with the relaxed hands and the relaxed fingers. Consequently, brush down the lateral side of the knee. Okay. And you can observe a positive test if you can see a wave of fluid floating down the medial side of the knee. Okay. Next, we will proceed in the patellar allotment test. It is done for the large amount of fluid present. It is used in assessing swelling in the knee joint, or the patient is in a supine position with a fully extended leg, throw downwards until you reach the suprapatellar. Okay, that's it. After that, we're going to assess the ankle and the feet. You need to inspect for swelling, redness, nodules, and deformities. Okay? So there are no signs of any swelling and any deformities around the ankle and the feet. Next is check for the arch of the foot and note for any deformity. Okay. And also look for the calluses, ingrown toenails, canyons, warts. Okay. Use the fingertips to palpate the bony and muscular structure of the ankles and the feet, and palpate each toe by compressing it with the thumb and fingers. And again, assess for the range of motion. Have your patient in a supine position with the leg is fully extended and the feet is hanging on the edge of the table. Okay, Mom Claire? I will assess now your feet and your knees. Okay. There are no signs of any ingrown toenails. While I'm palpating, there are no presence of swelling or redness. Okay. For dorsiflexion, I will instruct the patient to move the feet as far as possible towards themselves. Dorsiflexion. Okay. Okay, good. Next, Mom Claire, can you bring your feet as far as possible towards you, away from you? Okay, good. Okay. Okay now. For thunder flexion, I will ask the patient to put their feet away from her. And again, you will do the inversion to bring your feet as far as possible away from you. Bring the soles together here, 45 degrees to 60 degrees. Okay, good. Now, Mom Claire, can you bring your soles together? Do you find it hard or do you feel any pain? No. Okay. For inversion, instruct the patient to bring the sole away from each other. Away. Okay. Okay, good. For toe flexion, ask the patient to curl up the toes. Okay. Next is for toe extension. Bring the toes as far as possible towards you. Okay. Next is abduction. Instruct to spread the toes. Okay, good. And lastly, can you spread your toes for toe adduction? I will instruct the patient to bring the toes together. Okay. Okay, good. So that's it in doing the musculoskeletal assessment of our patient. And thank you again for our patient, Miss Claire Furuganan. That's it.